The following 20 minutes, I'd like to describe patients' characteristics and acute effects of patients receiving LSD and MDMA during drug-assisted psychotherapy and compare these effects in healthy subjects. So, as mentioned before, I'm a member of the psychopharmacology group at the University Hospital of Basel, where all the clinical studies have been conducted. In this case, for this study, special thanks goes to Dr. Peter Gasser and Dr. Peter Owen, as they were the psychiatrists conducting the drug-assisted psychotherapy in the patients and collecting the data and analyzing it with us. So, as you've probably known, or at least you've heard it over the last few days, psychoactive substances, including serotonergic hallucinogens such as LSD and psilocybin, but also the entheogen MDMA are increasingly used in clinical research and re-investigated in the treatment of various psychiatric disorders. Especially for psilocybin, several reports indicate beneficial effects on treatment of depression and anxiety, but also in treatment of addictive disorders. There are only few reports indicating beneficial effects of LSD and ayahuasca on the treatment of these disorders. MDMA, in contrast, has been repeatedly been shown to be efficient as treatment for post-traumatic stress disorder. Positive long-term effects of hallucinogens have been positively associated with their ability to acutely induce altered states of consciousness or induce mystical type experiences, not only in patients, but also in healthy subjects. In 51 cancer patients suffering from depression or anxiety, the treatment response to psilocybin was reversely correlated with the ratings on the mystical experience scale. So we see that patients showing higher ratings on this mystical experience total score showed lower ratings on the Hamilton depression or anxiety score. Patients suffering from treatment-resistant depression responding to treatment with psilocybin showed higher ratings in the oceanic boundlessness dimension of the 5-dimension of altered states of consciousness scale. So meaning that they scored higher ratings on this positively experienced derealization and depersonalization phenomena, including experience of unity, spiritual experience, blissful state, insightfulness. Conversely, non-responders to the treatment with psilocybin scored higher ratings on the anxious ego dissolution scale or the dread of ego dissolution scale, including higher ratings in anxiety, impaired control or cognition, or disembodiment, so the negatively experienced derealization and depersonalization phenomena. 1 year after just one single dose of 200 micrograms of LSD in healthy participants, positive, long-lasting effects on behavior and mood have been observed. When correlating these effects with the mystical experience scale and the 5D ESA scale, we see that the lasting effects on positive mood changes, on positive behavioral changes, and on change in well-being and life satisfaction are positively correlated with increases in the total 5DSA score or in the total MEC score. Switzerland has a unique position. Since 2014, few psychiatrists are able to treat treatment-resistant or patients with treatment-resistant various psychiatric disorders based on individual authorizations by the Swiss Federal Office for Public Health with LSD and MDMA. This was already possible between 1988 and 1993 and predominantly persons or patients with personality disorders, followed by adjustment disorders and affective disorders were treated, and patients, or a retrospective follow-up in 121 patients 2 years after the therapy, indicated the patients indicated increased feelings of unity and love, spiritual experience, visions, and experience of intense and unfamiliar sense perceptions were the main reasons, that contributed significantly to the subjectively increased or positively experienced therapeutic effects. So this is mostly clinical data, or data assessed in clinical settings, and we wanted to know what is it in real life, or real life data, not in a controlled setting. Therefore, we conducted this retrospective study in 18 patients undergoing this drug-assisted psychotherapy between December 2014 and March 2018. Patients repeatedly received MDMA and/or LSD. MDMA was used in doses ranging from 100 up to 175 milligrams, so quite high doses, and LSD was administered at doses ranging from 100 up to 200 micrograms. So these are doses that are typically used recreationally and are also thought to induce a full psychedelic experience. On average, patients underwent about six drug sessions every 3.5 months, and 3 to 10 non-drug psychotherapy sessions were in between. The 5D ASC and the MEC were administered after each study day, and patients were asked to retrospectively rate their effects during peak effects of the drug. In the compassionate use, a group setting was used, here shown on this picture. During group sessions, about 3 to 13 patients were present, with 1 to 3 investigators as well. The group sessions are conducted in a meditative, quiet environment, and music and silence is alternating, but allowing interaction with the investigator and other patients. In contrast, as I've told you before, we compared the acute effects of patients in this group setting with our healthy subjects. Our healthy subjects were treated alone in a standard hospital room. So only minimal interaction with the investigator, but no other stimulating environment. So first, let's have a look at the patient's characteristics. As I've told you before, in total, 18 patients were treated with LSD and MDMA, and you see that 11 patients were treated with LSD and 11 patients were treated with MDMA. This is due to the fact that 4 patients were treated with LSD after several doses of MDMA. Mostly female or more female patients were treated, 67%, and even more were treated with MDMA, possibly to other indications for treatment, such as PTSD, which is higher or more often in women. Patients were mostly middle-aged, ranging from their late 30s up to the late 70s. The main indications for treatment were PTSD and major depression, as we've already seen before. And we see that PTSD was mostly treated with MDMA, but also with LSD, and major depression was treated with both MDMA and LSD. So probably this could be interchanged. Additionally, other indications were also used, such as personality disorders, including narcissistic personality disorders, eating disorders, autism spectrum disorders, social anxiety, and life-threatening diseases and cluster headache. Patients with psychotic disorders or patients not able to be present at a group setting were excluded from this drug-assisted psychotherapy. With regard to somatic diseases, there was no exclusion criteria, and several patients were suffering from arterial hypertension, multiple sclerosis, glaucoma, and celiac disease. Antidepressants were paused before the sessions, but other medication was continued. So now let's have a look at the LSD-induced acute alteration in consciousness. We see that LSD led to a pronounced increase, mostly in the positive derealization and depersonalization phenomena, as shown with the OB dimension, and predominantly led to visionary restructuralization, including audiovisual synesthesia. Here you see different doses. Only the first completed questionnaire for each dose and participant was used for this analyzing to account for other effects. Overall, we do not see any difference. We just see here that the 100 microgram dose of LSD led to significantly higher ratings in audiovisual synesthesia than the other doses, but this is probably just a chance finding because there were only 2 participants completing this questionnaire. So when having a look at the dimensions, we see, as I've mentioned before, predominant increases in the positive derealization phenomena and visionary restructuralization, but overall, the ratings on the 5D ASA global score were similar in all the different doses that were administered in these patients. So now interesting is what is the difference between the healthy subjects and the patients now. Here, on red, we see the patients, and we see the healthy volunteers at doses of 100 and 200 micrograms. So if you have a look at the picture, shortly, there's no difference between the acutely induced altered states of consciousness after LSD in healthy subjects and patients. You see a similar pattern with mostly increased OB scores and visionary restructuralization. We only see higher ratings of the 200 micrograms in healthy volunteers with regard to the other 2 groups, but this is probably just because due to the dose that was used. Again, in the overall score, no differences were observed between patients and healthy volunteers regarding the effects on the 5D ASD. Now, what is MDMA doing on the 5D ASD? You probably remember other talks we've seen before, and we see that MDMA leads to a certain alteration of acute state or the altered states of consciousness, but to a much lesser extent than LSD. We see normally, or really sorry, or under LSD, the ratings were ranging between 30 and 60% on the total ASC score, whereas with MDMA, you only reach about 20% of the maximal possible score. However, again, no dose differences for different doses of MDMA in patients. Interestingly, in contrast to LSD, where effects on the 5D ESC score were similar between healthy subjects and patients, we see now significant differences between patients and healthy volunteers after MDMA. The only rating which was not different was the blissful state, maybe due to the empathogenic or entactogenic properties of MDMA. Otherwise, we see higher ratings in spiritual experience, insightfulness, complex imagery, and also in anxiety. So patients felt more threatened and felt more or were more afraid that the state they were in would last forever. This ultimately leads to higher ratings in the negatively experiences anxious ego dissolution, but also to higher ratings on visionary restructuralization. So, but overall, on the 5D ESC score, ratings were similar. So one could argue this is probably due to different settings or to the different populations that were compared in this. However, no difference found after LSD. Now, what did LSD do on the mystical experience questionnaire? We see that LSD also at different doses led to increases on all items of the mystical experience questionnaire. Similarly, as shown before, no differences in different dosages were observed, and total scores were similar between the different doses in patients. In comparison with healthy volunteers, again, similar picture as shown before for the 5D ASC. No differences between the mystical type experience induced by LSD in patients or in healthy volunteers. Interesting. Total mystical experiences as defined by reaching over 60% of the maximal score in every subunit was reached in 3 of 11 patients, and interestingly, in 5 of 27 healthy subjects under a lower dose, so the lower dose of 100 micrograms of LSD, whereas only 2 of 16 healthy subjects had this total mystical experience under 200 micrograms of LSD. But overall, there was no statistically significant differences in the occurrences of total mystical experiences between healthy subjects and the patients. Again, what are the effects on MDMA on mystical experience questionnaire? Similar as shown before for the 5D ASC, ratings are overall less pronounced than after MDMA. However, also MDMA led to similar increases in all items of the mystical experience questionnaires under different doses in patients. Again, as shown before for the 5D ESC, the same picture depicts for the effects of MDMA on the MEC compared between healthy subjects and patients. We see much more pronounced or significantly increased ratings for all subunits or items except for deeply positive, felt positive mood, again, probably due to the entactogenic or empathogenic effects of MDMA. The total score was significantly higher in patients than for healthy volunteers. So again, what's the cause for this? Probably setting or different population, or probably MDMA is just not strong enough to exhibit all these properties inducing altered states of consciousness and mystical type experiences as LSD. In both groups, no total mystical experiences occurred. So, with regard to all these results, we have to keep in mind that it's only a very, very small descriptive study. So only a few subjects were included in the study. There was no placebo control, and treatment efficacy was not determined. So we cannot tell anything about association of these acute effects we now described with the treatment efficiency. However, we can say that LSD and MDMA was administered safely in patients with various psychiatric disorders, so no serious drug-related adverse effects occurred, and which may indicate that there may be a broader spectrum of indications, or that indications or drugs may be interchanged for these indications. Additionally, we've seen no dose differences, so indicating or suggesting that even lower doses may be given for similar treatment responses. And last but not least, LSD or acute effects on the 5-DSC and the MEC after LSD did not differ between patients and healthy subjects. So one could discuss that the setting is not as important as previously thought, probably due to already potent inducement of LSD or alterations of consciousness. So these are questions that arise from these studies and which need to be further addressed in further studies. Thank you very much for your attention.
Okay, now we have some time for some questions.
Yeah, please. Thank you very much for your presentation. I have a question with regards to prior drug experience. So one could assume that they either had or had no encounters with MDMA or LSD. Did you ask them in any way, shape, or form? And did you track that process down to a month later, a year later, whatever?
Do you mean if they were still using some drugs afterwards or just before? Because we assessed whether they were taking these hallucinogenic or entheogenic drugs before, and we adjusted or controlled for this, and there was no differences, either in healthy participants or in the patients. There were only few that were using MDMA or hallucinogens, in the patient group only hallucinogens, and this didn't make any difference in the treatment, in the response.
That's interesting. That's good to know, but that's a reliable finding mostly. What I can imagine though is because you reported that some of them had fear responses, right? Which were a tiny bit higher. Now, if I know how drug works, I have much less chance to be afraid of what's happening as if I do not know how drug works. So that would be an interesting thing to look into.
Yeah, we did not especially look at anxiety for itself. It's just overall there was no difference. But this is very interesting, that's true. We should do that.
You said antidepressants were discontinued before giving the substance.
Yes.
How long before?
Normally, like 4 to 5 half-life times of the drug, so that one could assume that it's not out of the body.
Okay, what about other medication, benzodiazepines or
Benzodiazepines were stopped as well.
Okay.
Antipsychotics were not used in this study.
And do you have data on the response for the personality disorders?
No, we do not have any treatment, or we did not assess treatment efficacy, unfortunately, so far.
You mentioned that with MDMA they have elevations above those of the patient with normal people. In the mystical questionnaire, and there's no illustration to that, although MDMA provokes release of oxytocin.
Yes.
Do you think that has something to do with that?
I don't know. I thought or hypothesized that with the patients the setting would be more important for the experiences of MDMA, and due to the population that was used, they were more into meditation and spiritual active than our healthy subjects.
Maybe less defended, could you say that?
Yeah.